An Ebola patient will come to Atlanta for treatment. Emory University Hospital confirms it's preparing to receive a U.S. citizen who contracted the deadly disease. Good Day's Mark Teichner is live at Emory Hospital with the story. Mark, good morning.
Well, good morning, Karen. You know, for the first time ever, a person with Ebola will be not only on U.S. soil, but right here in Atlanta.
So we're quite confident that U.S. hospitals are well prepared to appropriately handle an infected person.
Emory University Hospital confirms it'll treat an Ebola patient. They haven't released the patient's name, but we do know it's a U.S. citizen who contracted the deadly virus overseas, possibly either Dr. Kent Brantley or Nancy Wright-Bolt, a pair of Charlotte-based missionaries who were working with Ebola victims in Liberia. The hospital will keep the patient in a special isolation unit, one of only 4 in the country.
What we call contact precautions and respiratory droplet precautions to prevent the spread of the virus in the hospital setting.
Access to the patient will be limited to medical personnel and possibly family. And those folks will wear protective covering from head to toe.
Anybody that's going to get in contact with this patient will have all the protective measures to prevent any kind of epidemic here in the U.S.
Emory officials say they train for events like this and are working closely with the CDC. Ebola has a 60% mortality rate. There's no known vaccine or treatment. The virus is transmitted either through direct contact or exchange of bodily fluids, typically contaminated blood. Health experts say the public shouldn't worry about the patient's treatment leading to an Ebola outbreak here.
Or the risk of having anybody here getting sick from the virus, it's very, very minimal.
A medevac airplane has already left for Africa to try to bring those patients back, but we've talked with some family members of them, and they say that their health might not be up for them to be able to make that trip right away. So at this point, there's no word as to exactly when the patient will come here to the hospital. We're reporting live from Emory University Hospital. Mark Teichner for Good Day Atlanta. Karen, back to you.
We will be following this story very closely. Mark, thank you so much for that.